Hello and welcome. I'm Mark Nemus with the Health Learning Intelligence interview series for the IQPC Disrupt conference. One of the select speakers for the event is Associate Professor Marcel Dinger, the CEO of Genome One and the head of the Kinghorn Center for Clinical Genomics at the Garvan Institute. Welcome, Marcel.
Hi, Mark. Pleased to be here.
Thank you for your time. And so just to explain, we're sort of in different cities within Australia at the moment, but in the upcoming presentation, you'll be talking about the practical applications of DNA sequencing and bridging the gap between research and clinical applications. So, how did you get sort of started in this area, and how do you see those challenges basically evolving?
Sure, Mark. So when I actually started out working in this area, I was a researcher. I was what they call a bioinformatician, which basically means that I dealt with using computers to deal with biological data. And that got me into DNA and genomics and DNA sequencing. And one of the things that I realized as a researcher was that we were starting to see more and more potential of this technology in patients. And this was becoming more and more clear that we, in the research that we were doing, we could see in the data that we saw in our findings that the information was actually relevant to the research participants. And we were more and more in a situation where we had to start returning information back to patients. And that's really when I started thinking, wait a minute, the people that are getting access to this technology at the moment are basically research participants. This should really be available in the clinic. This is actually a technology that has so much to offer, I think, people today that are looking for diagnoses to disease, that it became clear that we could actually start to translate this out from the research and bring it into the clinic. And I think that's really where it all started, and that really became the drive over the last 5 years, was how do we take this tool that's shown so much value and promise in a research setting in a clinical setting.
So if you had to identify, from what I was reading, and I'm no expert in the field, but sort of one of the mooted benefits was tailorizing treatments, making sure you're taking the right medicine for your right type of, effectively, DNA, according to individual DNA. Is this really true? Is it something that's sort of applicable now, or is this just something in the foreseeable future?
Yeah, no, so look, more and more so. So there are already some really compelling examples of where getting what we call a molecular diagnosis or a genetic diagnosis to a disease allows not only the tailoring of a treatment, it actually allows you to identify a treatment that's more likely to work. So in the case of many rare diseases where there isn't a clear diagnosis, it becomes, to an extent, there's a degree of trial and error in finding a treatment that works. With a genetic diagnosis, you've got a lot more certainty that the treatment that you apply has got a far greater likelihood of working, because you're understanding what's really going on. So it's a much more objective diagnosis rather than a subjective one, which has got a lot more opportunity for error.
So is it changing existing treatments? Sorry, is it changing existing treatments, or is it just making them more applicable or a bit more targeted?
So it is changing existing treatment, and I think particularly in cancer, there is a really quite considerable promise, and we are actually seeing the patterns of cancer treatment, particularly in advanced cases, being influenced, or where the treatment is influenced and patient management is influenced by having a genetic diagnosis.
Okay, so having this data, so there's sort of, if we look at healthcare at the moment as a system, it's almost like sick care. So we have some sort of condition, we go into facilities that basically treat us, and hopefully we come out better at the other end. What do you see are the impacts of almost not pre-diagnosis, but basically getting involved earlier to avoid conditions in the first place from a DNA perspective?
Yeah, look, that's a terrific question, Mark, and it's exactly it's one of the areas that we're really excited about, and about driving that capability in healthcare. I guess it's very established now that in developed countries, and like Australia, that the trajectory of healthcare spending is not sustainable, and that there needs to be a shift in our existing model away from purely from treatment and moving more and more towards prevention. So genomics has got a lot to offer there. It's not the only technology, but it's one of it's certainly a very important one in being able to anticipate the predisposition that an individual has to disease and how that may influence both their lifestyle and their and the care that they see from physicians in potentially avoiding the adverse disease outcomes, or through early intervention as well. And generally the cost of treatment of a disorder is obviously much less when it's caught early and when it's understood early, rather than when it's already in an advanced state. So I think that's having that foreknowledge, and being forearmed with that knowledge is an incredibly powerful, as an incredible potential to transform the way that we manage our health and health costs.
Given in line that human nature basically dictates that we'll pay 10 times more for something when we discover rather than 10% for prevention. Does everybody want to know, or does somebody, for example, if there was cancer in the family, they want to know their predisposition to this type of cancer? So that might be there's that sort of that interest was triggered in advance. But for other conditions, is it kind of like, the positives are absolutely there, but some people might go, oh, well, if someone gets hold of my information, I'm predisposed for this. Is this my path that I can't divert from? It becomes almost a philosophical question, I guess.
It is. You're quite right. It is very philosophical, and it's an interesting area at particularly at the moment. So in terms of the patients and the people that we see in Genome One, the majority are actually interested and they want to know, and if they do carry a particular predisposition to disease. So some of the areas is cancer and cardiac disease. There are very strong predictors that are available. So when family members have been affected by those diseases, people want to know, is that going to be my fate? Is there something that I can do about it to not go down that line? So, but it is very individual. When you do a survey in the street, I think you find that there's some people who don't want to know, and it's kind of like you think about like cigarette smoking, for example, is a pretty good example, is an interesting example of this, where it is well known, it's it's a scientific fact that if you smoke, it will lead to a worse health outcome for you, but some people are just okay with it, and they make that choice, and that's okay. But I think that there is and you can see that there is a majority of people that really do care about their health and want to do everything they can to maximize the quality of their health. And I think that's where genomics has got a lot to offer there.
There is. We were doing some interviews last week about blockchain and data and owning the blockchain data and distributed ledger. And it was also something that your data or your DNA actually has value not only to yourself, but in a de-identified way to a larger cohort. And that if you actually do have a rare condition, that actually, from a research perspective, you're actually incredibly valuable, right? From a genomics perspective. And so I guess my question is, our DNA or the things that we're doing, is this something that if we do have a genetic test, do we own that genome? Do we own the record of that? Do we own our own sequence? Or does it belong to the lab? And what can we as a general population today? Can I walk into a clinic and get sequenced, and then I can take that around to various different doctors, or is that too simple?
No, it isn't. It's a really good question and a very active area of debate at the moment. So to answer the question very simply, who owns the data actually is entirely dependent on the consent that you sign away for when you have your testing done. So there are many, and this is one of the areas of caution really around some of the particularly direct-to-consumer genetic testing companies, where you do in fact sign away the ownership of your data to the company that's doing the testing. And that's arguably why some of these companies can offer the testing that they do very inexpensively, because they're actually reselling your data to somebody else. So, but in a normal hospital setting, as a private patient, you would ordinarily own your own data because you paid for it. You paid for it to be produced. when the public system pays for it, it typically owns the data because they paid for it. Now, I would like to believe that our public health system, we can like any other test, we can have a reasonable amount of faith that the custodianship and care for that data is appropriate. But if you own the data yourself, I do think that there is a intriguing potential to be able to monetize your own genetic information and clinical information, and that in fact the more of the description of you or the clinical description of yourself that is made, you may indeed be able to realize value from that by, for example, selling it or donating it to research organizations or to pharmaceutical companies or to industry or something like that. And provided that there's appropriate protections in place regarding anonymity and that this is going to come and affect you personally in some way, then I think it's intriguing. It's certainly an area that's watch this space.
Cool. So in that, and we don't have much time now, but in sort of coming to a close, what sort of don't you want to see happen in the industry as much as what you do want to see? So we'll naturally finish off on what you do predict happening the next sort of, what are the 3 things you really want to see happening? But at the moment, what don't you want to see happening in this area?
Yeah, look, I think that the biggest, one of the greatest risks that we see at the moment in genetics and genomics is the over-promising of what the technology can do today. There's a lot of science fiction. You may be familiar with films like Gattaca, for example, which just had its 20th year anniversary, which paints a very dystopian future of how
old now. Thank you.
Yeah, of how genomic and genetic information can be used. And there are companies that are offering some tests that are probably not appropriate, and they're certainly not scientifically valid, and that could paint genetics in a very ill light, and that we could end up in a situation where the trust in genetic information is lost, or indeed that the information is used in a way that isn't good for society. So, for example, going down the lines of using genetic information to select for personal characteristics around appearance or something like that, for example, would not be a good thing. And there are some very dubious tests out there that are kind of exploring some of the space. And I think that'd be a shame. And if the health advantages became compromised as a result of that, or the industry became compromised by that, that'd be dreadful. I think the other area is really the use of genetic information really for any discriminatory purpose would also be a real shame. And so I think that where government and regulators, I think, need to be careful that they make it fair for individuals who seek genetic testing for health benefit, and that they're not in some way disadvantaged in society for having made a choice to have actually, improved their health.
I mean, it's all, the way the insurance system works is effectively on market risk and on group risk, provided everyone's in the bucket being insured. That actually makes sense. And the way it was been presented to me is that in some areas where if you insure based on risk, someone who engages in much more significant risky behavior basically should pay more for things that they're effectively doing to themselves. Like, right. If you're a smoker, you pay more for your life insurance because you're a smoker because of that activity. And I guess from what you're saying is, okay, if there's a certain DNA, sequence that has been scientifically proven to lead to this benefit or this perhaps not so good benefit, there is the potential there to basically bring the overall cost down, but the treatment cost down by focusing. But then also, like all good things, there is the potential dark side. So just in summing up for the session, the presentation that you're doing at the Disrupt conferences, what are the 2 or 3 things that are most exciting for you that you really see happening in the next few years in this space?
Yeah, so one of the major areas, and I think that's something that I am particularly passionate about, I suppose, is the intersection between genomic information and research, and changing that paradigm on how these communities interact. So today, clinical community and the medical research community are quite separate. Medical research kind of creates new knowledge that's ultimately, and it can take a decade, can be translated into some some form of improved care. But what we're seeing in genomics is that in that one test, we're creating information that's both valuable in a diagnostic setting, in a clinical setting, for providing an answer to a patient, and in the same time providing an absolutely invaluable piece of information in the research setting. So there's an efficiency there to be unlocked by, in fact, bringing these communities closer together, effectively using genomics as a glue or almost as a backbone to bring clinic and research together under a common framework. So I think that's an area, and it's developing, and it's exciting because it transforms both areas, two very important areas. I think that the other area, which we've touched on already, is in the opportunity for what genomics can do in preventative healthcare, and I think that's it's a transformative opportunity that we have in society today to apply genomics to reduce the incidence of adverse outcomes in healthcare and to maximize the opportunity for individuals to live as healthy a life as possible and potentially to stay out of hospital as much as possible, and live healthy and fulfilled lives. And I think that that's where we want to take genomics and where we want to build this technology.
Well, Associate Professor Massoudinha, thank you sincerely for your time today, and we look forward to your session on the Disrupt floor at the Disrupt Healthcare conference stage on the 28th of August in Melbourne. And if people would like some more information about the conference itself, you can go to the IQPC Disrupt Healthcare website. And if people are wanting more information about Genome One, certainly can sort of hit the genome.one website. So on behalf of Health Learning Intelligence, HealthXN, thank you very much for your time today.
Thanks, Mark.